Hello, and welcome to our first episode of Blue Line, the podcast in 2026. This podcast is created for and aimed at all members of law enforcement. I am Brittani Schroeder, editor of Blue Line magazine. In today's episode, I am joined by Chief Fiona Wilson of the Victoria Police Department. Now, back in late 2023 and early 2024, Fiona and I sat down to talk about British Columbia's drug decriminalization pilot project. At the time, Fiona was a Vancouver Police Department deputy chief and the president of the British Columbia Association of Chiefs of Police. With the recent announcement from the BC government that it will end the pilot and not seek an extension, I thought it was time for a little catch up with Fiona to hear her thoughts and maybe some lessons learned over the past few years. So thank you so much for joining me today, Fiona.
Hi, Brittany. It's such a pleasure to be here. Thanks for having me.
Thanks for being here, and I'm just going to dive right in because we have a lot to talk about. So, during our conversation a couple years ago, you noted that the devil is in the details regarding decriminalization. Now that the provincial government has decided to not renew the exemption from Health Canada, what specific details or implementation, let's say gaps, do you believe ultimately might have led to the pilot's end?
Thanks so much for that question, Brittany. That's a really good one. And what I meant by that is, police in British Columbia really supported and still do, for the most part, support the idea of not throwing people in jail by virtue of their substance use disorder. So finding pathways of health. We really do want to see substance use disorder being addressed from a health perspective. However, as I said, the last time we spoke, the devil is in the details in terms of how the pilot project rolled out. And certainly before the pilot project ever took effect on January 31st, 2023, myself and then Chief of Abbotsford, Mike Sear, we made it really clear when we were sitting on the core planning table that we had some significant concerns about how the exemption was actually taking form. And there were many of those concerns. For example, initially, there was talk about the threshold being up as high as 4.5 grams of illicit drugs. And, we had multiple conversations and did a lot of advocacy to drive that down to 2.5 non-cumulative totals. So that's one example. But one of the other major concern we flagged, and we actually wrote a position paper with respect to this at the time, was around public consumption. So, we were really concerned that when the pilot project took effect, if public consumption wasn't properly addressed, because when you decriminalize the possession, of course, you're also decriminalizing the use. We were really concerned that we would find ourselves in situations where there were problematic public consumption in our communities. And unfortunately, indeed, that's exactly what happened. And so that's what I meant when I said the devil's in the details. Overarching, we all agreed that we wanted to try and find pathways of health for people who are dealing with a substance use disorder. But we also wanted to make sure that our public spaces were safe and accessible for everyone in our communities. And that's why we flagged that concern with respect to public consumption. And of course, in the wake of the exemption, that's exactly what happened, unfortunately. We did see some really problematic experiences with public use.
Right. Now, an original goal of the pilot was to shift the perception of drug use from a criminal offense to a public health concern. And in your view, did the pilot succeed in reducing stigma for users, or did potential unintended consequences overshadow that goal?
Yeah, one of the unfortunate things about the pilot project and the way it rolled out is that people who are either ambivalent or even supportive of decriminalization at the beginning of this project really shifted their opinions because of some of the manifestation of those unintended consequences. And that was really unfortunate. But, that was a reality of not heeding some of those concerns that were raised prior to the exemption taking place.
Definitely. So the pilot took away the officer's legal right or legal authority to engage with individuals who are using drugs in public spaces. Now, how does the return to full enforcement of the Controlled Drugs and Substances Act change the daily reality for patrol officers, let's say in Victoria, in your own jurisdiction?
So initially, when the pilot project started, there were actually 6 exceptions to the exemption. So there were 6 places that you are not allowed to use illicit drugs under or possess illicit drugs under 2.5 grams.
Right.
The province, in response to concerns from communities across the province, came back and added an additional 3 exceptions to the exemption through Health Canada. During that time, the province was also working on enacting public use legislation, and unfortunately, that was subjected to an interlocutory injunction that prevented that legislation from ever taking place. So police in the province, and I was certainly at the forefront of this, advocated strongly for the province to roll back a lot of the exemption. And that actually happened in April of 2024. And that was the single largest impact on police. Because as you said, unless a person was in an exception to the exemption, and in the absence of any other kind of criminal behavior, police did not have the lawful authority to approach many people who were using in problematic circumstances in communities, in public spaces. For example, at a bus shelter, maybe there's a bunch of kids on their way to school. There was nothing preventing a person from shooting fentanyl or smoking crack cocaine at that bus shelter.
Right.
And during those first many months in the exemption, there was nothing police could do about that. Or at a beach, for example. There were many, many public spaces where people were allowed to lawfully possess and therefore use under 2.5 grams of illicit drugs. So when the province rolled back much of the exemption in April of 2024, only 3 places were left where people could lawfully possess under 2.5 grams. That was in a private residence, if they were lawfully sheltering overnight, and in a healthcare facility, many of which already had Section 56 exemptions. So really the biggest change for police happened in April of 2024. Now that the exemption is completely being allowed to expire, I think the biggest thing police will notice is with respect to that lawfully sheltering overnight. There are some shelter facilities that were encapsulated in that location. And although police weren't often engaged or called in those circumstances, that's the only one that I think will make a slight difference towards how police utilize their powers under the Controlled Drugs and Substances Act.
Right.
But for the most part, the changes we saw were in April of 2024.
Now, when we spoke in 2024, you also raised concerns about the liability of officers returning seized drugs to individuals, fearing that it would lead to potential overdoses. Does the end of the exemption provide your members with more legal clarity and maybe relief regarding the property handling and that liability?
Absolutely. And as I say, those changes primarily happened in April of 2024. But what it means is that if our police officers come across somebody, for example, who's smoking fentanyl on the sidewalk,
Mm-hmm.
they now have the lawful authority to approach that person, to arrest them for possession, to advise them of their charter rights, to search them incident to that lawful arrest, to check their name, to check for warrants and no-goes and conditions and things like that. And then they can use their discretion with respect to how they move forward. And I'll give an example. If they're really, really close to a supervised consumption site, they might allow that person to keep the small amount of drugs that they have and direct them to that supervised consumption site, understanding that when we seize a person who uses drugs, illicit substances, it can cause harm, right? It can force them to go to a dealer that they're not familiar with, or put them in a position where they feel like they need to commit crime to get the money to replace those drugs. However, if they're in, for example, say there's somebody that our police officers are coming into contact with over and over and over again, and they've been warned several times, or if they're not near a supervised consumption site, or for whatever reason, the member feels that it is safer for them to actually seize those drugs for destruction, they can use their discretion to do that as well. We have a number of guardrails with respect to actually requesting charges for Section 4.1 simple possession under the Controlled Drugs and Substances Act. Crown has made it very clear through their desk book policy that they will only approve those charges in British Columbia, because we're a charge approval province, in really extreme circumstances. And then we have sections 10.1 to 10.4 of the Controlled Drugs and Substances Act that require our police officers to look for alternatives to requesting charges. The important thing is they have that lawful authority back now to arrest that person and then to use their discretion to move forward with them.
Amazing. Thank you for also citing all of these different sections of the acts. Like this, you are very knowledgeable on this, and I appreciate all of this. In a recent statement from the BCACP, of which you are past president, they noted that there was a noticeable increase in public drug use and street disorder during the pilot. Now, from a leadership perspective, how can we balance a measured approach to enforcement with the community's demand for safe public spaces?
Yeah, and I think that comes down to our members' discretion. But if we don't have the lawful authority to intervene in the first instance, and we always teach our members to make sure they're on strong legal ground before they engage with somebody, now that we have that lawful authority back, I trust my members to use their discretion and to try and do what's in the best interest of the individual they're dealing with, but also to consider the larger community around making sure that our public spaces are accessible and safe for everyone.
Yeah.
So, here in Victoria, we have a significant challenge with street disorder. And so I encourage my members to engage with people. We just stood up a beat team in the last 2 weeks to actually walk the beat in Victoria specifically. And I encourage them to use their discretion, but to really send a strong message about what is and what is not acceptable on the streets in Victoria, so that we can make sure that sidewalks are clear for people who have disabilities, for example, and are in a wheelchair, so that people with young children feel safe to walk down the street. I think that our job as police is to make sure that we are caring for everyone in community. That includes people who use drugs. That includes people who want to live and work and play in public spaces. And, I think we need to find that balance, and compassion is the key. Compassion and using our discretion and making sure, of course, that we're always on firm legal ground.
Of course. I think you really got it there, finding that balance. Now, in our previous discussion, you compared BC's model to Portugal's, because Portugal has also done something similar, but you noted that Portugal's success was built on a foundation of a massive investment in treatment and recovery. Given that BC still faces a significant gap in publicly funded treatment beds, was decriminalization ever, I don't want to say viable, but was it ever viable without those resources in place?
So, one of the things that we did not see in the wake of the exemption coming into effect was that dramatic increase in resources. And I think that's a really important point. There just wasn't the uptake or the uptick rather in resources in health that, for example, they saw in Portugal. Another big distinction with the Portugal model is that, police weren't taken out of the equation.
Right.
So in British Columbia, one of the main objectives of decriminalization was to remove police from the lives of people who use drugs. And although ultimately, I think that should always be a goal to reduce police interactions with anyone, I think is also always a really important and laudable goal, but it's not reality. The reality is that our members are constantly coming into contact with people who use drugs, people who are suffering from mental illness, people who are in crisis, you name it. And so I think the notion of trying to remove police from those spaces is naive. And given that we are the ones who are so frequently interacting with people who use drugs, in my mind, there is an opportunity. There's an opportunity between that space where we have the lawful authority to arrest someone and the request for charges. And that's what happened in Portugal. So police still had the lawful authority to intervene. However, there were alternatives, diversion from the criminal justice system to the health system.
Right.
And I think that's a key difference. And I would like to see us work together with the province on a project moving forward where we're really focusing in on that space, where our members are interacting with people who use drugs lawfully because they have the authority to do so, but taking advantage of that space that falls short of actually requesting charges. And maybe that's diversion or encouraging people to explore those pathways of health. And that's what happened in Portugal. And it was a significant difference from our project here in British Columbia.
Right. Now, you've advocated for treatment on demand and treatment that is accessible and free for a while now. And I did notice that the BC provincial government put in, I think it's about 550 million into the system in their 2025 to 2026 budget for the mental health system and aimed at this. Do you hope your officers see a difference in their ability to divert people from the justice system into actual care with this kind of investment?
So I am always hoping for that. I am always hoping that my members are going to have access to resources that they can direct people to who are struggling. And quite frankly, Brittany, whether that's with respect to someone who's in an abusive relationship, someone who's being exploited, an elderly person who's subjected to fraud, a person who uses drugs who's ready to access treatment services. My hope is that our police officers always have support in community from government that they can refer people to for them to get help. And, people who are dealing with substance use disorder are no different than that. I think it's a complex issue.
Mhm.
And really, I think of it almost like a puzzle, and we need all of the puzzle pieces to create the picture. And that, in my mind, is everything from harm reduction services that keep people alive while they're in the throes of addiction, all the way to that treatment on demand when they decide their window is open and they're interested in getting clean, and everything in between. So, I really think that it's going to take an all hands on deck approach for us to deal with this challenge. And unfortunately, the toxic drug supply has never been more deadly. It's never been more damaging. I realize that our overdose deaths have decreased in the province and across the country, and in fact, across North America in the last year. However, the impact of illicit drugs has never been more damaging. We see people who have acquired brain injuries. We see people who have physical effects of illicit drugs that we have never seen in the past. And, I think that is the single most significant change that's happened over the last 5 to 10 years. And that is that the drug supply has never been more toxic and harmful. And so anything we can do to try and prevent people from ever using drugs in the first place, and then when they do, keeping them alive, and then when they're ready for treatment, to get them that treatment quickly, effectively, and like I say, everything in between, I think is what we need to be doing to try and address this crisis.
Of course. And of course, as we address this crisis, you mentioned earlier that, unfortunately, police are involved in at least some part of the stage, in most cases, not all cases. Um,
Yes.
and the BCACP has actually called for an evidence-based national dialogue on substance use policy. In your opinion, how can police services across Canada lead this conversation while ensuring that they preserve public trust and community safety?
So that's a great question. I'm the co-chair of our drug advisory committee for the Canadian Association of Chiefs of Police.
Mhm.
And the CACP does so much incredible work across the country. And one of my goals as co-chair of DAC is to find common ground from province to province on issues that impact policing, where we can come together and advocate for positive change. And the CACP is a great mechanism to do that. Certainly, even decriminalization, even though it only occurred in British Columbia, we were constantly working with our police leaders across the country with respect to ensuring that they understood what happened here to inform decisions that were being made in their respective provinces. And so the CACP is really a fantastic mechanism for police leaders to be able to do that kind of work.
Now, I think you've shared a lot of them, but in your opinion, what would you say is the most important lesson that you guys have learned during this pilot project? Maybe regarding the collaborative effort between the police, health authorities, the government. What do you think is the most important thing you learned?
So that's a great question. So, there's a couple of things. The first is that I have so much respect and admiration for police leaders in this province being willing to have the courage to try something different, to try something that was really progressive and, really done in an effort to try and move the dial on this tragedy of the opioid crisis and the number of deaths that we're seeing. I also think it takes a lot of courage to stand up and say very clearly when something is not working. And that's exactly what happened here in BC. And so I have a lot of respect for police leadership in this province for A, being willing to try something different, and B, being willing to stand up and use our voices to say this is not working and in fact is damaging communities. I think that we could not have been more clear as police leaders in this province about what some of our concerns with the pilot project were. I think about that all the time. I mean, we wrote a position paper that was presented to the province on behalf of police in the province. And unfortunately, the concerns that were flagged in that position paper really did manifest in the wake of the exemption. So, I would like to see a situation in the future where we continue to collaborate with the province, where police are really given the credit they deserve for understanding the complexities of this issue in particular. And, the reality is, whether we like it or not, police are constantly, daily interacting with people who use drugs and are in crisis. And, that we're a wealth of information in terms of how to try and address some of these societal issues. And my hope is that moving forward, we can continue to work in our respective provinces to try and move the dial on these things. But lots of lessons learned. But I think that my biggest point of pride is the fact that, police were willing to try something different, but also, as I say, willing to come out and speak clearly when something wasn't working.
Yeah, that deserves major. I think I'll revert back to my teenage self and say major props for being willing to try something new. Because yeah, like you said, BC was the only province to do it and to try it out. So you guys really set yourself apart there in trying something new. In the BC government statement last week in mid-January, the health minister, Josie Osborne, stated that addiction is a health issue, not a criminal justice issue. Yet, as we've discussed, like the pilot project is ending and enforcement powers are being fully restored. So to leave off, I'd just like to know, how do you and how do the officers at Victoria Police Department, how do you plan to navigate this middle ground moving forward?
Yeah, so the direction I've given to my members here at Vic PD is to remind them of their lawful authority, to let them know that my expectation is for them to exercise that lawful authority when they come across situations where people are behaving in a manner that is not conducive to everyone in our community being able to use those public spaces safely. And quite frankly, and this is certainly a debate that happens frequently, this notion of, is simply using illicit drugs in public spaces damaging to people in community? And I would argue that it is. I would argue that people do not want to walk past somebody who is shooting fentanyl on the street. And I understand the complexities of substance use disorder. I have a lot of empathy and compassion for people who are in that space. But as police, it's our responsibility to ensure that we have safe, accessible spaces for everyone. And so from a Vic PD perspective, I am instructing my members to make sure that they exercise their lawful authority, but to always do so in a way that's compassionate and thoughtful. And, I always expect them to treat everyone with respect and dignity, and really to do everything they can to help people access those pathways to health. But, I think it's important that we're always keeping our eye on the fact that our public spaces and the use of those public spaces has to be for everyone in our community, not just one segment of our community. And so that's really my messaging moving forward.
That's great. And I wish Vic PD and also all policing services across BC the best of luck, the most positive outcomes as you guys transition back out of this pilot. And maybe this just continues the conversation on how to help people and assist them while still enforcing the laws that are in place to keep people safe.
I certainly hope so, Brittany. My hope is that moving forward, police will continue to work, at the municipal, provincial, and federal level to try and tackle some of these really, really wicked challenges we have. But I have to say, I'm happy to see the end of the pilot project. And I'm looking forward to moving on to the next project to see how we can try and address some of these challenges.
Definitely. I like the forward thinking there. Fiona, I just want to say thank you so much for taking the time. I know you're very busy to speak with me today and join us on the podcast. I know we covered a ton of ground here in a very short amount of time. So I appreciate that you've been here and you've referenced so much experience and all of the stuff. So thank you.
It's my pleasure. Thanks so much for having me, Brittany.
Of course, I'm gonna have you back. It's gonna have to happen. For
good.
everyone who tuned in today, we hope you enjoyed this episode of Blue Line the podcast. You can check us out on YouTube, Spotify, iTunes, or wherever you get your podcasts. You can also stay up to date on all of your Canadian policing news at blueline.ca. Until next time, stay safe and be well.